does all of this mean for you? Well, city officials urging New Yorkers once again to reduce your exposure by staying inside with doors and windows closed. We can't say that enough. If you must be outside, wear an N95 mask and use an air purifier if available. But if you have respiratory issues, you need to pay very close attention to your health, as we are in uncharted territory. Let's bring in Dr. Jonathan Newman now, a cardiologist with NYU Langone Heart. Dr. Newman, thanks for being here.
My pleasure.
So first, what are you hearing about emergency rooms around the city, even at NYU? Are they being filled with people having issues related to the air pollution?
That's a good question. I haven't heard much about a change in emergency room census at NYU. I have heard from other urban centers in New York State, the emergency departments there being perhaps less affected than might be expected with a big spike in air pollution exposure, potentially driven by public policy warnings about staying indoors, limiting time outside, and other preventive measures to, let's say, mitigate a burden on the healthcare system through emergency room visits.
You specialize in how the environment contributes to health impacts, especially of the cardiovascular system. What kinds of problems could come from breathing in this kind of air?
So they're both acute and chronic effects. Acutely, there are known respiratory effects from air pollution exposure and known cardiovascular effects. Some of the areas in which I focus are changes in blood pressure or increases in blood pressure from both acute and long-term air pollution exposure, changes in blood glucose, leading to or exacerbating diabetes, and other systemic effects on health that can be mitigated or dealt with on the individual level as we work towards larger policy changes to draw larger attention to some of these worrisome trends.
Yeah, and what kind of symptoms should New Yorkers be aware of if they're in trouble? You know how New Yorkers are. We're always on the go. We never want to think it can happen to us. But what's a danger sign?
Sure. Well, I'd say that worrisome signs in general of, let's say, health risks related to air pollution or more broadly would be, let's say, acute onsets or sudden onsets of chest pain, of difficulty breathing or catching one's breath, of shortness of breath, doing daily activities, let's say, that is out of proportion or something new or unusual based on other levels of activity that people may have. And a lot of these symptoms can be made worse when the air quality levels, as you described, are so worrisome as we were seeing today. Even sitting indoors today, I noticed that I had a headache, my throat felt itchy, eyes felt a little raw or irritated. Those in and of themselves are not particularly worrisome symptoms, but certainly for vulnerable individuals, let's say, that have multiple risk factors for heart disease, like high blood pressure or diabetes or chronic kidney disease, or have a history of heart disease, or the very young, infants or newborn children with other medical problems, certainly air pollution levels in the range that we saw today can be worrisome, and every measure to avoid prolonged exposure or physical activity is warranted.
Okay, Dr. Jonathan Newman with NYU Langone. Appreciate your time tonight. Thank you.
Thank you.